Yeah, a very good afternoon to one and all present in this Zoom meeting. Warm and hearty welcome to this virtual program on Red Color Day celebration, that is teaching and learning session, which is jointly organized by Department of Pathology, SS Institute of Medical Sciences and Research Center, JJM Medical College and Basveshwara Medical College, Chitradurga. First of all, I thank our patrons, Shri Shamnu Shivshankrapaji, Chairman, Bapuji Education Association, and Chairman of SS Institute of Medical Science and Research Center, Shri S.S. Mallikarjun Sir, as well as our beloved principal, Dr. B.S. Prasad, for permitting us to conduct this virtual program, which is a part of our Thesaurus Slide Seminar series conducted every month, which has just begun last month. So on this day of 14th February, everyone is celebrating Valentine's Day. This day also marks the blood that is shed by our soldiers in the Pulwama attack in 2009. So to mark this day, we are dedicating this learning in pathology, which is we have the Valentine color also as red, as well as the blood, which is red in color. So on our professional front, we would say our Valentine would be our subject, that is pathology. So love for pathology would mean better patient care. So the red color has a range of symbolic meaning, including life, health, vigor, war, courage, anger, love, and religious fervor. So to start with, we have a note by our principal and medical director. Our principal, Dr. B.S. Prasad, has conveyed his message.
Good afternoon to all of you. At the outset, on behalf of SS Institute of Medical Science and Research Center, I'd like to wish a very happy Valentine's Day for all the eligible Valentines. At the same time, I also say that pathology also, which is very important, pathology. And my sincere thanks to the Department of Pathology in our institute for conducting monthly an academic program, and today's topic is something good with respect to gross, micro, and histopathological techniques. We always believe that it is as good as his pathology or pathophysiological knowledge. And hence these techniques are very important in early diagnosis of the disease, which will definitely help patient outcome. So once again, thanks to all the faculty members and speakers from different institutes involved in this monthly academic program. And I'm sure this program will be delegates getting involved in this program. Once again, wish you all the best. Thank you very much.
Thank you, sir, for your encouraging words. We also have address by our director, Dr. Arun Kumar Ajappa, Professor and Head Department of Anesthesiology.
Hello. Good morning, everybody. Just came to know that Department of Pathology, which is always brimming with action and doing a lot of academic activities, and always at the forefront of serving the society in the form of running the blood bank. And our blood bank we always praise Department of Pathology for doing so. Not only that, the academic activities, the lab they have, and the museum they have is fantastic. And this concept of celebrating today with everything red is something very unusual and very thoughtful. So I wish the Department of Pathology to have a wonderful day of red pathology, whatever you call it. And I'm a nice time to all of you today.
Thank you very much, sir. Dr. Arun Kumar Ajappa, sir. We are thankful to you for your wishes. And I would like to say, when we look at a personality, so as a personality, a person who likes red means a determined person who takes action and is not afraid of taking risks. They are assertive, vigorous, prone to impulsive actions, and have variable moods, and they radiate energy. And we have such personality, our own madam, Dr. Shashikala, whose favorite color is also red. So, so I would like madam to share your views on red.
Thank you, Dr. Kavita. And this red color, of course, I like red color. See, I just kept asking questions, 2 questions to people. So one set of questions was to consultants, my friends. When we say red color, what comes to your mind? Okay, so I got a set of answers because each one of us think something about the red color. Then the next question was, how do you relate red color to pathology? So let us see the answers what I have got. A red color, what comes to your mind? Relate red color to pathology.
Thank you, madam. It was a wonderful smiling what people think about red.
Please mute. See, when then this idea of reds in pathology related, that is red related to pathology came, and then Dr. Vardendra and Dr. Narayan Murthy were quite ready to cooperate, and then all 3 of us with the faculty have joined together to present you reds in pathology on this particular day. A very nice teaching learning session, and we want you to contribute more to it. And to begin with, so we have a title song also, and who else can sing the title song other than Dr. Bharat, who has sung nearly 12,000 songs, in Smule. So let us listen to Dr. Bharat, the title song, before we go on to the teaching learning session.
We love pathology.
Yes, we all love pathology. We love pathology. Yes. So thanking Dr. Bharat, who is the head of the Department of Pathology. So this concept was by Dr. Neeta, our associate professor. Then Dr. Neeta and Kavita joined together with the lyrics, and then Dr. Bharat. So he presented the song to us. So let us move on to Reds in Pathology. The first session is by Dr. Narayan Murthy and team. So BMCRI Chitradurga.
Seeking the blessings of His Holiness, Sri Dr. Shivamurthy Muruga Sharanaru. I thank management, SJM Vidyapita, Dean Dr. Prashant, and Medical Superintendent Dr. Palakshaya for their continuous support. Red is in color of blood and passion and heat. It is a positive color associated with many things like love, lust, desire, romance, stress, danger, action, and more importantly, determination. These are the people behind RRR. I mean to say red, red, red. Red is not just a color, it's an attitude. It has a story to tell. Red is an energizer. It excites our emotions and our will to survive. It signifies leadership qualities and admiration. Valentine's Day is celebrated on February 14th every year, color of which is again red, and also called Red Day celebration. In this context of Valentine's Day, we from Basaveshwara Medical College and Hospital, Chitradurga, in association with Department of Pathology, SS Medical College, Davangere, and Department of Pathology, JJMMC, Davangere, are presenting to you shades of red encountered in pathology. At first, we are focusing on shades of red in urine, which can be seen in various physiological and pathological conditions. Urine examination is very important and used to detect wide range of disorders. Thanks to Shashikala Madam for creating such an opportunity. Hope you all like this presentation.
A great person once said, "What is a human? When you come to think upon him, but a minutely set, an indigenous machine designed to turn with infinite artfulness the red wine of Shiraz into urine." Having said this, we will jump into the shades of red in urine. Red in urine, the first thing that comes to our mind is hematuria. That is blood in urine. Okay, when the hematuria is extensive, we can see a urine, red urine with a naked eye. That is called as gross hematuria. But sometimes when the hematuria is very minor or very small in amount, you may not be able to see red color with naked eye, but you will definitely see RBCs on microscopic examination. Causes of hematuria as shown in this picture: pre-renal, renal, or post-renal. That is inside the urinary tract. But before we jump to the conclusion of hematuria, as we see red urine, we have to rule out the other causes like contamination due to menstruation or intake of certain substances which can cause red discoloration of urine, like beetroot, various colorful berries, or some drugs like chlorpromazine, rifampicin, etc. To test for the pH of the urine, the classic gold standard test is using litmus paper. The blue litmus paper turns to red in acidic urine. But nowadays, more often we use a reagent strip test as shown in the picture. Another good old gold standard test is the Benedict test, where we test for the presence of reducing substances. When the sugar is more than 2%, then we get a brick red precipitate. which indicates a positive Benedict's test. Another similar test is the Felling's test, which is used to detect presence of reducing sugars. Here, when the test is negative, we get a dark blue precipitate. And when there is presence of sugars having aldehyde and alpha hydroxy ketone groups, then we get a positive test, which is indicated by dark red precipitate. The Earlix aldehydes test is used to detect the presence of indose or urobilinogen in the urine. A normal amount of urobilinogen is present. The test gives a pink color. When the amount of urobilinogen is high, as in hepatitis or hepatic jaundice, it gives a nice cherry red color to the solution. I'm sure we all love pathology. Thank you.
Yeah, thanks to Dr. Narayan Murthy and team for beginning this session, and we have the next session to be continuing. So in traditional cultures, red objects were believed to convey health, it seems. So like, for example, we have red stones like garnets and rubies, which were believed to have health-giving and disease-preventing properties. So let us see what else in red is in store for us from Dr. Varadendra and Dr. Neetu from JJM Medical College. Over to Dr. Varadendra and Dr. Neetu.
Okay, so we have riddles in between. So whoever answers the riddle will get a prize from Dr. Narayan Murthy, Chitradurga. So we'll start with the riddles in between the session. So all related to reds in pathology.
Dr. Neetu, can you hear?
Yes, ma'am.
Yeah, please start.
Please present from your side.
Yes. Yeah, we have given access, you can share.
Yes, ma'am. Just give me a moment. We'll share our screen.
Okay.
The screen visible?
Yes.
Good afternoon, everyone. This is Dr. Varadendra Kulkarni, HOD of Pathology at JJMMC. I wholeheartedly welcome all the participants for this session, which is titled Red in Pathology. So it's an initiative started from Department of Pathology at SSIMS by Dr. Shashikala ma'am as a part of this Thesaurus Light Seminar series. It's a very innovative series and we are getting to learn a lot of things in this series. So we congratulate them on this initiative and wish them all the great success. So this, I believe, is the second edition in the series, and today, which happens to be the Valentines Day, we are talking on what is red in pathology. So as it was previously described, red denotes a lot of things. It denotes courage, it denotes life, it denotes health, it denotes vigor, it denotes purity. And definitely red is one of our favorite colors as well. So as you can see, our entire theme is painted in red. That shows the enthusiasm. And today we are celebrating our love for pathology by sharing with you all what all is red in pathology. So I think you must have read a lot about what is red in pathology, but while reading, you may not have read in between the lines, trying to note what is red. So today, in this session, I introduce proudly my colleague, Dr. Neetu GV, Associate Professor in the Department of Pathology, who will be taking through all the reds which we had read, but we had not read with the intention of reading them again and again. So today, we will live through all this. So over to Dr. Neetu.
Thank you, sir, for those inspiring and enthusiastic words. May I start now, madam?
Please.
Can you see the slides?
We are seeing your group theme picture. Yeah, you can go to the next one. Yes. No, it's yes.
So when we say red in pathology, what comes to your mind first? Anyone from the audience can answer, and even my postgraduates are here. What comes to your mind first? When you hear the word red, what comes to your mind? RBCs. Okay, anything else? So RBCs are the first things which comes to everyone's mind when we hear the word red in pathology particularly. And first thing could be hemorrhage and then the RBCs. So can anyone recognize these people? Can you all recognize them? Yeah, who is Rudolf Virchow in this? On the right hand side or left hand side? Okay, on the right hand side, it's Rudolf Virchow. I'll come back to this picture later. So what is this? You can identify this. Yes, this is rubor. So in context to this, who do you think these are? Rudolf Virchow, and who was the one who discovered signs of inflammation? Person who described signs of inflammation. So on the left hand side, it's Celsus, who described the 4 cardinal signs of inflammation, that is rubor, calor, dolor, and tumor. On the right hand side, it is Rudolf Virchow, who described the 5th sign of inflammation, that is loss of function. The red in pathology, first is hemorrhage, then RBCs, and now it is one of the signs of inflammation, that is rubor. So can you name this organ? So this is the spleen, which is showing red pulp. The red pulp occupies 75% of the splenic volume. It filters, its function is to filter old and damaged RBCs. So can you identify this organ? And what is it showing? Red infarct. So name other organs which show red infarct. Organs show red infarct. So it's testis and intestine along with the lung are the 3 organs which shows red infarcts. What's the reason behind it? So this is a tumor or neoplasm which is seen in pregnancy. So what this could be? That's red degeneration in fibroid. So what is the tissue here? What has happened to the neurons? These are known as red neurons or acidophilic neurons or eosinophilic neurons, which is a sign of acute neuronal injury due to CNS hypoxia or ischemia. They represent the necrotic or apoptotic cells in the CNS. So these are the red neurons. These are the red neurons in acute neuronal injury, which show intense eosinophilic cytoplasm, which are stained by the proteins which are broken down. So what is this tissue again? What is the one which I have marked? So this is again CNS tissue. The one which I have marked with yellow ring are the Negri bodies. What are these Negri bodies? These are cytoplasmic round to oval eosinophil inclusions seen in the pyramidal neurons in rabies. So strawberry tongue, I have added a simile also on the right corner of the slide. In which conditions we see strawberry tongue? Kawasaki and so we can see this condition in scarlet fever and Kawasaki disease, which is acute febrile vasculitis, which is seen in children. So that is strawberry tongue. This one? What is the organ? Cervix. What has happened? So this is again strawberry cervix seen in Trichomonas vaginalis infection. This one? Red leafy tongue, which is seen in vitamin B12 deficiency. So this is a section from the lung. So this is red hepatization stage in pneumonia. So these are pap smear with Parabasal cells with hue staining red. So in which condition you see this? For lactational Parabasal cells. So what are this? What is on the left hand side and what is on the right hand side? Yes. On the left hand side we have target lesions. On the right hand side we have petechiae. What is the difference? Yes, the target lesions, they have a central pale area surrounded by hyperemic borders, whereas petechiae are small pinpoint hemorrhages on the surface of the skin. So what is this? Okay, anybody from audience other than our postgraduates? Postgraduates from other.
Ma'am, it's larva migrans.
Yeah, that's right. It's cutaneous larva migrans where patient gives history of traveling to endemic areas and walking in barefoot. So it will initially start at small reddish papule that progress to serpiginous pleuritic rash. So that is a cutaneous larva migrans. This one, this is again on the skin. So this is pinpoint bleeding that is seen on the surface of the skin when the scalings are removed because of the bleeding from the subcutaneous capillaries, which is seen in psoriasis. It's Auspitz sign. We also have Erythroplakia, which is red velvety area which is seen within the oral cavity. Can you identify these lesions and name the site of these lesions? So these are mainly situated on the face and mucocutaneous junctions. So these are capillary hemangioma. So here I am showing one more capillary hemangioma which has regressed over a period of time. This one, which is present on the scalp. This is again cavernous hemangioma, which is appearing red and purplish. So these two micrographs are histopathological micrographs of cavernous and capillary hemangioma. Cavernous hemangioma, where you can see large areas, large vessels, cave-like spaces which are filled with blood. Whereas on the right hand side, you can see the proliferating capillaries, which is a capillary hemangioma. Otherwise known as birthmark or nevus flammus, which is a benign condition of malformations, vascular malformations, which is usually unilateral pink or red in color and seen in the newborn, which is known as port wine stain. This one, a red nodule which is present on the skin. Anyone from the audience? Any other postgraduates from other colleges? One more clue I would like to give is the patient is immunocompromised. And Wagner's starry special stain shows the organism. Dermatosis, where you can see lobular proliferative histiocyte. This one again, this is an immunocompromised patient who gives history of plaques, who gives history of developing plaques, and later they turn to be nodules. What would be the diagnosis? So our postgraduates are telling that it is Kaposi sarcoma, which is right. So initially they will present with patches, plaques, and later on they evolve into nodules. So what are the books with red cover page in pathology?
Robin's 10th edition.
Yes, that's right, Robin's 10th edition.
Hematology journal.
Favorite book for all the postgraduates and even staff members.
Yeah.
Journals, any journals?
Hamat journals.
So I just found 3 books, you can add more. One is Robinson Cotter on Pathologic Basis of Disease, then American Journal of Hematology, then Indian Journal of Hematology and Blood Transfusion. So happy Valentine's Day from all of us from this end. So this is our team, our beloved HOD with all staff members and postgraduates.
Thank you, Dr. Neetu, for that wonderful presentation. So I take this opportunity to thank Dr. Shashikala madam, who came up with this brilliant idea. Actually, when ma'am discussed this idea with me, I was a bit skeptical because I didn't know how this is going to unfold. But then I was sure that definitely when it has come from Shashikala madam, there has to be a amazing idea behind this. So we went with the flow, and today we are here with this presentation, trying to gather everything that's read in pathology. We had never looked at pathology from this perspective. So thank you, ma'am, for organizing all this, and it's over to SSIMSRC.
Thank you, Dr. Vardendra and Dr. Neetu, for that wonderful presentation. So as Dr. Vardendra put it, all the reds in pathology, which we had thought we had read, but we had forgotten or probably not read, are all presented here. So thank you. Thanks a lot for the wonderful presentation. So let's move on to more reds in pathology that are still awaiting to catch our attention.
So wonderful presentation, Dr. Vardendra, from your team, and then Dr. Narayan Murthy from your team. So now it is left with us. So let us see what our faculty have.
How are you? I'm good. Hey, let's talk about red in pathology today. Why all of a sudden red in pathology? Hey, you forgot today is Valentine's Day, right? Can you identify the specimen? This is a specimen of showing chalky white deposits. So is this calcinosis cutis of scrotum? Yes, exactly. This is a specimen of calcinosis cutis of scrotum. You told about red in pathology, but why you are showing white color? Can we make this red? How? Yes, with alizarin red stain. Yes, this alizarin red S will stains the abnormal deposits of calcium found in the necrotic areas of tissue associated with tuberculosis, infection, atheroma in the blood vessels. So in the presence of calcium, this alizarin red S binds to the calcium to form a lake pigment that gives an orange to red in color. So that dyes like alizarin red S, purpurine, naphtochrome, green B, and nuclear phosphate are used for this to stain the calcium. This calcium will usually stains purple blue with a HND stain. And this method is particularly useful in identification and detection of the small amounts of calcium. So on tissue sections, these calcium salts will appear as an orange red in color. So this is an alizarin red stain. So this calcium will appear as orange red in color. Now I also want to tell you about some red stains. Oh, I'm curious then. So what are those stains? Yeah. Sudan 3. So Sudan 3 was one of the first dyes to be introduced in 1896. It was followed by Sudan 4 in 1901. Oh, these two are such an old stain. Yeah, okay. Both these dyes are closely related to oil red oak. Okay. So the lipids that exist as fats, namely the oily and greasy hydrophobic lipids, have affinity for the Sudan dyes. The adsorbing power of fat is related to the dye concentration, temperature, and physical state of fats. Maximal dye uptake occurring around its melting point. So this is also a lysochrome or lipid-soluble dye predominantly used for demonstrating triglycerides in frozen tissue sections. For use in histochemistry, a saturated solution of Sudan 3 in isopropanol is prepared, and then the tissue is counterstained with acid alum hematoxylin for 5 minutes. So the result is lipids appear yellow, orange, or reddish in color upon staining with Sudan 3. Okay. And nuclei will appear blue and cytoplasm will appear green. So this is a picture of Sudan 3 staining showing the presence of triglycerides. So they are stained orangish red. Another stain, Sudan 4, its basic structure is same as Sudan 3. The only difference is it has 2 extramethyl groups. Okay. So because of these two extra methyl groups, Sudan 4 is much deeper and more intense in color. Okay, better than Sudan 3. Sudan 4 is also a lysochrome dye used widely for staining of triglycerides in frozen tissue sections. So for histological staining, a saturated solution of Sudan 4 is prepared and used in tissues. So this is the picture of Sudan 4 staining showing the triglycerides in tissue, which is stained orange red. Yeah. This is Sudan 4 staining of hepatic tissue, which is showing the presence of triglycerides. Oh, that's nice.
This is a rapid fire round in this Reds pathology. There's just 4 questions or 5. So if you answer all the questions, I'll give it also. Okay, ready? Yes. Yes. First question. Start? Yes. What's the color of oil red? Red. Is oil red a fluorescent stain? No. What is it used to demonstrate? Urine. What is its application in forensic pathology? I don't know. 1,000 rupees for me only now. You didn't answer. Okay, correct. Oil redo. Then it is used, you said. For the oil and lipids, yes, its application in forensic pathology is it is used to demonstrate the latent fingerprints. That is an okay. Can you do the stain on paraffin sections? No. Okay. So, how many questions has she answered?
4 out of 5.
4.
Yes.
3 only, no. 1 I gave the answer.
Yes, sir.
Yeah. It is a fluorescent dye. It is a fluorescent. So 1,000 rupees remains in me. So let us listen to Srividya. Let us listen to Dr. Srividya. So she would be telling us about oil red O, the principle and the applications of this.
Hello everyone. Can you see this picture here? Very bright color, very obvious. What is it? Yes, red. So let's know oil red O stain. So what is the stain? This is a lysochrome, which is a fat-soluble hydrophobic diazo dye, which is used to demonstrate the fatty acids, neutral lipids, and the triglycerides in the sections, especially the frozen sections. So what is the principle here? The principle that we use here, that is used here, is these lipid depositions are demonstrated by using dyes which have got greater solubility in the lipid substances in the sections. Okay, they are more soluble than the usual hydroalcoholic dye solvents that are used. So how do the tissue section appears? The lipid, whichever is deposited, will take up the red color, which is bright, and then using the counter stain, you can stain the nuclei as blue. However, there's a limitation. This cannot be used, or it is not compatible for the regular paraffin sections, because the hydroalcoholic substances like xylene and alcohol that we are using, they dissolve the fat. So we cannot demonstrate or use this oil red O in a regular paraffin sections. So these are mainly used on the frozen sections. So now we know that oil red O can demonstrate the lipid, that is neutral triglycerides, lipids, and lipoproteins. But what is the application of this? So it is necessary for us to demonstrate the lipid, especially in liposarcomas, to differentiate it from other types of tumors, and in cases of xanthofibromatosis, to demonstrate the xanthoma part, and in the Rayleigh syndrome. One more condition where we use this oil red O is fat embolism. So whenever we encounter this long bone fracture or crush injury, there will be a hypovolemic shock which causes the flushing out of the traumatized fat into the lymphatic channels, and that will be very well demonstrated using the oil red stain. The other application is lipid storage disorders, namely the hemolytic disease. Then to demonstrate the steatohepatitis in case of chronic alcoholic. Now on the left side, you can see the reagent that is used,
And on the right side, you're seeing the working solution that is prepared. So now we have used this. This was an interesting case of glycoid pneumonia where could very well demonstrate the lipid-laden macrophages in the bronchoalveolar lavage. Then second one, this picture, as I told you, in cases of fractures and crush injuries, we have a fat emboli in the lung tissue. So the oil red O is very well demonstrating these fat emboli as red dots. Then similar, last one is the steatohepatitis. Can you see how bright and well the changes that are seen in a chronic alcoholic patient who is in a condition of steatohepatitis? It's very well demonstrated. Thank you.
Hello, ma'am. Happy Valentine's Day.
Thank you, ma'am.
Yes, thank you. You're looking so pretty. That additional, lipstick, that red color, has added so much beauty to your face. Where does this red color come from? Okay. So, are you a vegetarian? Not pure vegetarian. Oh, it's not pure vegetarian. That means you are vegetarian. You know why I'm asking you this question? The blushing, huh? That's good, yeah. It is said that the day we stop blushing, that means we are old. That's true. Hey. When you look okay, so this is physiological redness. So we are talking about pathological redness, right? See this? What does this remind you of? Kumkum, yes. Kumkum. I always put sindoor here. Kumkum, right? And have you seen this? Even I have not seen. So this is supposed to be a cochineal insect. I'll show you the next slide. Then you decide whether you wear red lipstick. Okay. So cochineal is a red dye. So that is extracted from these insects. Okay. They call it as cochineal bug also. And it is a female insect. So the females of a scaled insect species, these are found in Mexico and Central America. And it's reported that more than 70,000 of these beetles are killed to produce just 1 pound of the dye. Okay, so used mainly in cosmetics. But why I have taken up this here is we do use it in pathology also. So look at this. Read what is written there. Red food color and lipstick, among other things. Okay. We eat lipstick? No, but when we apply the lipstick and eat something, it enters our body, stomach. Yeah. So this is carmine. And these are insects which live on cacti. And they put their proboscis into the plant and then they suck the cactus juice and all that. And to protect themselves, they produce some fungus-like substance, a waxy substance which is white in color and it covers the insect because they need to get protected from other harmful insects which eat them or birds and all that. See, on crushing, this one insect is taken and crushed. See that color? They say blood red, but this is from where the carmine is derived. So it's a red pigment or the dye that is derived from the insects, native to South America and then Mexico. So textiles also they use it. Why I was just reminded of this stain was my professor, Dr. Benedict. He used to ask all the PGs, that's a favorite question. He used to ask, which is the best stain for glycogen? So he was giving us a clue in that question. So many people could not answer, they're not able to say best carmine also. And next question was, he used to ask us, which is the stain or the dye which is very costly? Because this is obtained from insect and not available everywhere. So that is carmine. And this carmine, it's a very a vivid crimson color. Such a nice color, right? Red color. And it stains glycogen granules red. So we call this what type of a stain? I told you whether This is purely natural, or now semi-synthetic forms are available. A complex of aluminum and the natural dye, that is cochineal carbonic acid. And the selective, why it stains only the glycogen? And why we say it is best? Because it selectively stains glycogen. That is due to hydrogen bonding between phenolate groups of the dye and the glycogen hydroxyl groups. So this is how just taken a picture from the net to show how glycogen in the hepatocytes appears with best carbon. Nice, no? One of the natural dye. So it is on your lips now. So the red color. So thank you, Neeta. I took you as an example. Okay, you are so cooperative. Thank you so much. You are sitting with the red screen because it's red day.
Yes,
Rama. Okay, I'll ask you a question. Fine. So if I show you like this, what comes to your mind?
something bright and fluorescent.
Oh, you have read about it. Can you talk about fluorescent dyes? Because there are some of the fluorescent dyes which give a red color also. I'm not well versed with any of these dyes. Yes. Let us just go through the names of it.
These are some of the fluorescent dyes which
Your familiar ones?
rhodamine.
Nile red. Okay. Auramine, rhodamine stain. Fine. Oh, there's a big list. Acridine orange, yes. We have used acridine orange once for demonstration of tubercle bacilli also. Next. This is a picture that is showing the red fluorescence. The rhodamine, what is it used for?
It is used in ELISA, flow cytometry.
Okay, fine. Next. Nile red. Usage?
In a lipid-rich environment, deep red is shown for the polar membrane lipid.
Okay, fine. Okay, auramine rhodamine stain. This is for tubercle bacilli. What color do they take up?
Reddish yellowish.
Reddish yellow fluorescence.
And used in RNA-seq.
Yeah, very nice. It's about fluorescent stains or yeah, right. Okay, thank you. Thank you so much. Yeah, you're well read. Yeah.
Thank you.
Good. Okay. Aparni, can you tell me more reds?
Yes, ma'am. In Congo red, we can stain that.
Congo red. Okay, then. Okay, I'll tell you. Congo red. Now let us see about Congo red, because this is one of the most common stains that we keep using. Okay. Let's leave the history of Benhold, because there's one method of staining Congo red using Benhold's methodology. So Congo red is an acidic azo dye. Two factors that are most commonly required or most important for Congo red reaction are, can you read that?
The linearity of the dye molecule and beta-plated sheet configuration.
Very good. Yes. So there are so many methods. You know what method we are following for Congo red staining. So this is how the Congo red stained amyloid. So when we talk about Congo red, the first thing comes to our mind is amyloid. So it is both an in vivo stain and in vitro. Now nobody will use it as an in vivo stain. Okay, what is this?
It is
HND,
stain,
which is pink. So with Congo red, it is
red in
orange, red, or red. And
in birefringence, it will show
under polarizing microscope, it shows
green.
apple green birefringence. But remember, recently you read an article which said the polarizing, the birefringence color could be yellow. Yeah, green, yellow, or orange. See why this is important for us to observe whatever is red with Congo red staining under polarization is there are certain substances which have congophilia. Just remember a few: collagen, elastic fibers, fibrin, and other proteins. Okay, so I'll show you something. You should tell me what it is. Look at this flower. We have not seen, right?
Yes.
So Ponsio is another red color stain. So this is supposed to be French. Poppy color. Okay, poppy is maybe what I understand is this red color, which is strong reddish orange color. Yes. So this is Ponsium, and it is supposed to be a food dye, and I don't think they're using this as a food dye now, and a histological stain. Where is it used? Heavy Western blotting, and nitrocellulose means electrophoresis, acetate, cellulose acetate electrophoresis. So these two are such bright red colors, right? Yes. Yes.
Roses are red, violets are blue, and I am thinking of you.
What, Nandini, you're singing song? You're remembering somebody.
Yes,
Your
ma'am.
Valentine.
Yes.
Oh, Valentine's Day special.
Yes, ma'am.
Everybody is busy preparing on red colored histopathology stains. Now, what have you done?
Ma'am, I have done stains that highlight tissues in red color.
Oh, really?
Yes, ma'am.
Let me see. Oh, you've done on Vangeson.
Yes.
What is Vangeson stain?
Ma'am, it is a mixture of picric acid and acid fasting. It's the simplest method of differential staining of collagen and other connective tissue. It is used to differentiate between collagen and smooth muscles in the tumor. Also, it is a counter stain for Verhoff stain.
Okay, yes, nice.
The principle here is picric acid provides acidic pH. It acts as a counter stain for muscle and cell cytoplasm, forms a complex with the dye which has affinity for collagen.
Okay, how does it look on staining?
This is an image showing collagen that is deep red in color and nuclei black in color and other connective tissue yellow in color.
Yeah, so very nicely because the vessel has collagen around it, it has highlighted the collagen in red color. Nice. What is this?
Different tissue sections highlighting the collagen red in color.
Okay.
The applications of Vangesons are, it is used to differentiate between collagen and smooth muscles in tumors, to demonstrate increase of collagen in diseases, and atrophy of elastic tissue can also be demonstrated by Verhoff Vangeson stain.
Yes. Mason's trichrome also.
Yeah.
Okay, it has also got red color in it.
Mason's trichrome is a three-colored staining, and the components are bibrick scarlet acid fasting solution, phosphomolybdic acid solution, aniline blue solution, acetic acid solution, and acid alcohol differentiation solution.
You can use any counter stain, either blue or light green. So whatever you use, it will highlight. It looks so beautiful, no? So many colors in Mason's trichrome. Can you tell me what are all these?
Red color and blue or green color by collagen. In principle here is less porous tissues are colored by the smallest dye molecule. Whenever a dye of larger molecular size is able to penetrate, it will always do at the expense of the smaller molecule. This is interpretation of Mason's trichrome stain. Keratin and muscle fibers are red in color. Collagen and bone are blue or green in color. Cytoplasm is light red or pink in color, and the nuclei of the tissue is dark brown to black.
So colorful it looks.
Yeah.
Mason's trichrome.
And the applications of Mason's trichrome are in muscular dystrophy and cardiac pathologies involving infarct and liver cirrhosis, glomerular fibrosis, and also to detect and analyze tumors on hepatic and kidney
Yes, in
biopsies.
all these cases, the fibrosis or collagen and fibrosis is highlighted.
Bibrick scarlet, it is a part of Mason's trichrome stain. And the principle here is phosphomolybdic acid or phosphotungstic acid is used as a decolorizing agent, making bibrick scarlet acid fasting to diffuse out of collagen fibers, and this leaves the muscle cells red.
Yes.
Here we can see that muscles are bright red in color due to bibrick scarlet.
And the collagen looks blue.
Blue. It is used as plasma staining Mason's trichrome.
Okay. So, what is Samiksha? Has she done something in red color?
Yes, ma'am. She has done a neutral red.
Okay, let me see what have you done, Samiksha. Thank you, Nandini, for
Thank you.
beautiful slides.
Hello, ma'am. Today on the theme of Valentine's special, I have done on neutral red.
Oh, it's looking so bright red.
Neutral red dye, it is used in general histology staining as well as in a counter staining with in combination with other dyes. And it stains lysosomes red. Here in this picture, we can see the lysosomes has taken red color, and together with genus green, it is used as a supravital stain. Okay. It is a weak cationic dye that readily penetrates the cell membrane and accumulates intracellularly in lysosomes because lysosomal pH is less than cytoplasmic pH, where it binds with anionic sites with the lysosomal matrix.
Where else can we use this?
Generally, it is used as a general stain in histology. It can also be used as a counter stain in combination with other dyes. It stains Golgi apparatus in cells and Nissls granules in neurons. It can also be used as a growth medium for bacterial and cell cultures. It is also used as a pH indicator between pH 6.8 to 8, and it can also be used as a chloride salt.
Okay, nice. This color is looking so bright. Thank you, Samiksha.
Thank you, ma'am.
What is red here? Okay, if I tell you this is Alcian blue stain, what is red? You can hear me? Am I audible? Audible? Okay. Yes, fast, Nandini? This is nuclear fast red. This is one of the stains used to stain the nuclei. I had told you that, you have left it. You have not done this. Yeah, let us move to the next one. So nuclear fast red, which stains the nuclei red in Alcian blue. So this is a popular alternative to hematoxylin, and it typically stains the nuclei in just 5 minutes. Maybe we don't want to see the nuclei red. Yeah, this is saffron in stains the cartilage, mucin, macles, and all orange to red. See the background, which is green, nuclei are black. And this is a very popular counter stain for gram stain also. Okay, any other test that gives a red color in clinical pathology, semen analysis? Okay, in many places still we continue to do this Selivanov's test to detect fructose in semen. So if fructose is present, the positive test gives a cherry red color. Cherry red colored complex is formed. Yes. So I request all the delegates, to add more color, that is not more colors, more red to this red colored day. And then please forward it to us on our email, which we are going to share, or on the WhatsApp, so that we document all this. And a prize is given for your contribution. So sponsors, Dr. Narayan Murthy, as I said. So Dr. Vardendra, your PGs are there? You're there?
Yes, ma'am, very much.
Okay. There are just 5 questions. So prize, our PGs cannot participate. So other delegates can participate, okay? So based on what we have learned here, okay? So first riddle says, I am sweet. Please don't help your PGs. I am sweet, but you make me red to confirm if I'm sweet. Who can answer? Anybody who has answered, you can tell. Yeah?
Benedict's test for the urine analysis.
Okay, Benedict's test for urine analysis. So it could give red, blue, blue is negative, green, yellow, orange. Okay, this is based on, I'll give you a clue, based on histochemical tests, not included clinical pathology. I am sweet, but you make me red to confirm if I'm sweet. Anybody wants a clue? I spoke about it. A failure of a question, no? Lakshmi has answered. Lakshmi says, no, I said histochemistry. Second part, Lakshmi is wrong. It is glycogen, carmine. Glycogen says I'm sweet, but you make me red to confirm if I'm sweet. Vardendra, is it okay? Approved?
Yes, ma'am.
You're
Yes,
approved.
definitely.
Okay, fine. Fine. Okay, next. Half chocolate. There's no sharing business here. COVID time. Okay. Okay. Srividya has made something which, okay, had turmeric color, changed to kumkum color. What is it? I'm telling you related to histochemistry. A big clue.
Yellow to red.
PG's JJM. You want me to repeat the question? Dr. Srividya. No, you saw her presenting. Dr. Srividya has made something which had or resembled turmeric color, turned to kumkum color. Histochemistry.
Fat.
Very good. Who said fat?
Shruti.
Shruti Kallur. Yes, Shruti Kallur, correct. So with what did she make that fat look red? Turmeric look like kumkum stain?
This Sudan.
Okay, even that could be taken. Shruti, send your number to us. Okay, so next, this is slightly out of the histochemistry. So you have heard presentation from JJMMC. Okay, I am red. I disseminate knowledge. You may, please listen. So you may or you need my help for climbing the ladder of promotion. I am red. I disseminate knowledge. You need me to become a professor, to climb the ladder of.
Robinson.
Anything else? Lakshmi, you keep quiet. These questions are for you, for PGs.
Books, ma'am.
What books? Books are for
Publications.
Who said that?
Madam, our PG is answering publication and journals.
I mean, you have to tell properly with journal. Neetu has shown you. Fast. She showed 2 journals. Do you remember which are red?
Journal of Hematology.
What is it? An Indian journal. Okay, so we'll move on to the next 2 riddles. Doctor, yeah, somebody has answered this. Okay, Sujay, you are correct, Sujay. Okay, so next one. So this stain says, oh thief, don't touch. I will catch you. Who am I? Oh thief, don't touch. I will catch you. Who am I? What is this? You were all attentive, no? This is a repeat question. There's a repeat question. Clue is this.
Madam repeated that. I mean, Madam mentioned that in her talk.
What is this? Lakshmi is a failure. What is the question? I said, oh thief, don't touch. I will catch you. Who am I? I said some stain in forensic medicine. Sujay. Sujay, you called it as fixative. It is oil red. Oh, correct, Sujay. Fine. So the last one. Okay. So it says, it's furious. It is furious with a red face. Why? Because we said anger also red color, right? So it says, Though I'm at par with hematoxylin, laboratories use it sparingly. Whatever we have learned here. Yeah? No, alizarin red is potassium. Oh, Shivarama Krishna, you get. So he said nuclear fast red. I showed you. Yeah. Shravani also. Sharvani and yeah. Please note down the names, no? So Dr. Narayan Murthy is there. So we'll send you, Lakshmi will not get it. So we'll send you a prize. So that prize is related to the affective domain because we are talking about red and red says love and that comes from the heart. So you know what is that related to affective domain, which is very, very valuable. So you get that. Hope you people can read Kannada. Okay, so now we have Neeta. So the last event of this red color day celebration. Dr. Neeta is our associate professor.
Hello, everyone. I hope all of you enjoyed this session. Yes? Yes? So we came to know so many things about red in pathology, right?
Yeah, we knew everything, but it was in bits and pieces. We have put them all together.
Yeah. Right. So, so I would like to convey my thanks to everyone who have contributed for the success of this session. So first of all, we would like to convey our gratitude to our chief patrons, Dr. Shamnur Shivshankarappaji, and our chairman, SS Mallikarjun sir. Secondly, we would like to thank our beloved principal, Dr. B.S. Prasad sir, and our medical director, Dr. Arun Kumar Ajappa, for letting us conduct this program. A special thanks to our HODs of pathology, Dr. Vardendra Kulkarni, JJMMC,
Vardendra and team,
Dr. Narayan Kumar, Dr. Narayan Murthy and his team from Basaveshwara Medical College, and Dr. Shashikala P, HOD of SSIMSRC, who is the organizer and the moderator of this program. We thank all the speakers, Dr. Neetu, Dr. Srividyalata GM, Dr. Disha, Dr. Ramya for their valuable contribution towards the success of the program. I thank all the PGs of our department and also our department of other college, all the delegates, without whom this program would not have been possible. Okay, last but not the least, I would like to thank all the participants who have spent their precious time by involving in the session. So Valentine's Day doesn't mean only for the lovers, right? It can be celebrated by anyone who have love for their sisters, brothers, love for reading, and also love for the subject.
So today we said we all love pathology.
So on this day, we all showed that we all love pathology. So we do not know how many of you got a gift from your Valentine, but we, the Department of Pathology, SIMS and RC, JJMMC and Basaveshwara Medical College have all given you the gift of knowledge regarding the reds in pathology. Hope you all enjoyed it and cherish this fun learning session forever. Thanks for making it a wonderful or memorable day.
Yeah. So Dr. Narayan Murthy and team and Dr. Vardendra and team will, I'm sure, continue with us in this, in such teaching learning sessions. Yes.
Thank you and all. Happy
thanks
Valentine's
to
Day.
Aparna. So lastly, she wants to sing. She wants to sing. Yes. We love pathology. Sing. All of you, I think JJMMC, you can say. We love pathology.
Yeah, all of you please join for the song.
A college, एक डिपार्टमेंट, एक कॉलेज, एक डिपार्टमेंट का नाम है पैथोलॉजी। ये मेरा पैथोलॉजी, ये मेरा पैथोलॉजी। I love pathology. I love pathology. A college. डिपार्टमेंट, एक कॉलेज के डिपार्टमेंट का नाम है पैथोलॉजी। I love cytology, I love hematology, I love histopathology, we love pathology.
Once again, thank you all for participating in this program and all the contributions from the different colleges. I mean, JJ Medical College and Chitradurga Basveshwara Medical College. We are very thankful to you for your active participation, and we look forward to your support in future too.
We love pathology. Yes. Come. Screenshot here.
Thank you, madam. Thank you.
Thank you, Narayan.
Thank you, madam.
Thank you so much. Thank you, Dr. Control print screen. Just sit there and you also will be seeing.
Can someone take a screenshot of the grid view of all the participants?
Yeah, please, you also be there on the video.
Name the entire team. Yeah, please.
Yeah, screenshot. Control print screen.
Control. Narayan Murthy idira hodra. All those who are there, please come on the video mode. Those who are there. Yeah. Please, all others who are there, come on video mode. Ah, Sonam, we can see. Sujoy, yes, Suresh Nagwadi. Dr. Suresh, yeah.
Please put on the video so that we can take a screenshot.
Yes, Pranjal. Others who are there, please come on video mode. We'll take a picture. Ramakrishna. Yes. Video mode, please. Others, fast. Click, no? Keep clicking.
Control print screen.
Control print screen.
Just paste it on, minimize it and paste it in the. Open a PowerPoint.
From here it comes.
Pictures and
Here.
It's there. Okay.
Keep taking screenshots.
Keep taking screenshots.
Okay.
Yes. So Nandini also has come.
Scroll and scroll.
Scroll. Go to the other screen.
Yeah, here you can take this one.
Yeah. Thank you all.
Only 2 screens.
Yeah,
Only 2 screens. Only 2 screens.
yeah, fine. Thank you.
Thank you, ma'am. Happy Valentine's Day.
Thank you. Thank you. Oh, yes.
I love my pathology.
Oh, very good. I love my pathology. Something said. Okay, we'll leave.